let me explain about epiglottitis. In this PowerPoint, I'm trying to print something in your mind so that you can answer the question in NCLEX board. This PowerPoint only focus the NCLEX materials. Here we go. Epiglottitis, right? The epiglottitis, it is the inflammation of epiglottis because of bacteria or virus. Most of the time, epiglottitis causes by bacteria, we call bacterial crop, and causes by Haemophilus influenza type B. This is bacteria. If epiglottitis occur because of virus, we call crops. When a patient comes to you with epiglottitis, we see excessive drooling or patient age group 2 to 8 years. Patient have a inspiratory stridor. Epiglottitis is a life-threatening medical emergencies, and patient need immediate hospitalization, patient need oxygen, and we protect the airway, maybe need tracheostomy. Let me read this page first. So here we go. It is a bacterial form of crops. If I ask you, what is epiglottitis and what does it do? Your answer would be, it is a layer of skin at the base of tongue. So you see the picture, this is the base of tongue. Up there is a organ called epiglottis. In case of epiglottitis, it opens and closes during the breathing. So the normal function of epiglottis, it open and close during the breathing. The problem when inflammation occur, like this picture, the picture number 1, this is epiglottis and this is trachea, and there are some fold here. Picture 1 is a normal larynx and epiglottis, but picture 2 we can see the epithelium muscle layers is inflamed. When the inflamed, too much secretion, they make the pathway narrow and obstruction, no air going in or out. Obstruction and narrowing the pathway or respiratory pathway resulting from edema and crops, right? So what are the major organ can cause epiglottis? We call Haemophilus influenza type B. Let me read it. Epiglottis, an inflammation of the epiglottis occur which may be caused by Haemophilus influenza type B or Streptococcus pneumonia. Children immunized with Haemophilus influenza type B are at less risk to develop epiglottitis. So if you children get vaccinated against the Haemophilus influenza, they have a chance to reduce less epiglottitis. And now go here, occur most frequently among the children who are 2 to 8 years of age, but can occur from infancy to adulthood. If NCLEX board asks, what is the usual age of children who get epiglottitis? Answer is 2 to 8 years. Some books said 2 to 7 years. Some books said 2 to 5 years old. All is correct. So the onset is sudden or abrupt, occur most often in winter, and considered an emergency situation because it can progress rapidly to severe respiratory distress. So, as I told you, if we do not take care, do not give the medication, epiglottitis lead to the respiratory distress, and patient present with restlessness, tachypnea, tachycardia, dyspnea, or nasal flaring, retraction, wheezing, or diaphoresis. So, as a healthcare provider, what are the nursing care? So, we use a combination of back and blows and chest thrust for infant. So let me go next here. What are the signs and symptoms of epiglottitis? We call data collection, right? So patient present with a high fever or sore throat, red, inflamed throat, and pain on swallowing or absence of spontaneous cough, right? Or patient develop the dysphonia, means muffled voice, or dysphagia, dyspnea, and drooling. So what will the child look like during an episode of epiglottitis? Usually the patient when present, they sitting upright, look like this picture, we call tripod position, sometimes tongue protruded outside, drooling, swallow, or rapid breathing, right? So here, this is easy way to remember: dysphonia, dysphagia, dyspnea, and drooling. Saliva came out, shortness of breath, or dysphagia, or muffled voice, we call dysphonia. Also retract the child. Retract means, it does mean the children struggling for oxygen, they need oxygen. The picture number 1, this one is a ribs and this is the clavicle. The space in between two ribs we call intercostal space. This area filled up with the intercostal muscle, and also the muscle here is called subcostal muscle. This area is called subcostal muscle. So intercostal muscle or subcostal muscle does not participate in respiration if everything is okay. But this accessories muscle can participate in respiration if there are any difficulty of respiration. Body try to compensate. When body is struggling to get oxygen accessory muscle to participate, and that times we can say inward and outward bulging of intercostal muscle we call retraction. So in the picture number 2, we can see inside, right, depression in between two ribs. This is retraction. It means your baby need oxygen, they're struggling for breathing. If I ask you, can epiglottis be treated at home? Answer is no. The child must go to hospital immediately, right? Let me read it. Respiratory stridor aggravated by supine position. If you examine, we can get tachycardia, tachypnea, means heart rate go up, pulse rate go up, respiratory rate go up, because patient is under anxiety. And tachypnea progressing to more severe respiratory distress lead to hypoxia, hypercapnia, oxygen level go down, carbon dioxide accumulate in the body, hypercapnia, or respiratory acidosis, finally lead to decrease the level of consciousness. And patient, when you see the patient, you can see they are sitting upright, we call tripod positioning. So while supporting the body with the hand, the child lean forward. So like this picture, the child lean forward, two hand over the knee joint, tripod. And here, sternal retraction. And here we can see the normal nostril, but when baby trying to get more oxygen, that you can see the nostril is more dilated, and it is called flare nostril. What are the nursing intervention? Nursing intervention, we maintain the patient airway. So in picture here, this is the pathway, or because of epiglottis, the pathway is narrower. You can see the picture number 1 is the normal healthy individual, but in the picture number 2, because of inflammation, because of excess secretion of the gland, area is congested and pathway getting narrower, difficult to respiration. It is medical emergencies. So what are the priorities? Maintain the patient airway, maintain respiratory status, and also breath sound. Also, we can see assessment first, excluding nasal flaring, use of accessory muscle retraction, or when you put the stethoscope over the trachea, we can get added sound we call stridor. All of this indicate your patient have a epiglottitis. So assessment is most important. Then go for nursing diagnosis. After the diagnosis, we go for implementation. Do not measure the temperature by oral route. It is dangerous. Monitor the pulse oximetry. If we see the saturation of oxygen less than 95%, we give them the oxygen. So prepare the child for lateral neck flames to become the diagnosis. Also maintain nothing by mouth status and do not leave the child unattended. So always the healthcare provider should be with the patient. Avoid that placing the child in a supine position because this position will further affect the respiratory status. Do not restrain the child. Assist administration of IV fluid or give them intravenous antibiotics, right? So what are the medication will be given to treat epiglottitis? We give them IV fluid, we give them IV antibiotics. So antibiotics therapy is a treatment of choice, right? So in NCLEX board, if you get how can epiglottitis be avoided by getting Haemophilus influenza vaccine. Next, admin the analgesia and antipyretics because of fever, high-grade fever. Acetaminophen or ibuprofen is the drug of choice. It reduces fever and throat pain. Administer corticosteroid to reduce the inflammation and reduce the throat edema. Medication that promote the mucosal vasoconstriction and reduce the edema may be prescribed. Provide oxygen therapy and also have resuscitation equipment should be available. Prepare for endotracheal intubation or tracheostomy for severe respiratory distress. In NCLEX board, if the child cannot breathe, what might be done? We called intubation or tracheostomy. What next? Ensure that the child is up to date with the influenza, because influenza vaccine can be avoided epiglottitis. If epiglottitis is suspected, no attempt should be made to visualize the posterior pharynx or obtain a throat culture or take an oral temperature. We never do this. Otherwise, spasm of epiglottitis can occur, which lead to the complete airway occlusion. And this is the danger for the children, and it can lead to the death. So we never do this.